Hello dear patients and our followers, I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic, Istanbul, Turkey. Today we are going to evaluate the case of the patient who underwent a hair transplantation surgery in our clinic almost 15 months ago. This is a 44-year-old male with the Norwood type 4V to Norwood type 5 of the hair loss. We always stage the hair loss in the patients according to the extent of the hair loss, and for this purpose we use the Norwood Scale. On Norwood Scale, the male pattern baldness is basically staged from level 2 to level 7. Level 2 means the lowest degree of the hair loss and level 7 means the maximum. Level 1 means no hair loss in our case. For Norwood type 4V to Norwood type 5, the patients on average you may need the numbers varying between 4 to 5,500 grafts. Of course, numbers change from patient to patient depending on the size of the open area, the density you want to get, expectations of the patient, and the extent of the hair loss, of course, as well. In this case, we were able to extract the number 4,200 grafts. One of the distinguishing features of this patient that is slightly different from the other patient is that he had the patchy hair loss. He had some good areas, some weak areas, some empty or bald spots as well. So it's a kind of a challenging patient with combined type of the hair loss where you have some areas with the hair with no hair. This is very important for us during the planning as well, because if the quality and distribution, density of the grafts are in a good way, we try to preserve this area and do the implantation around it, so we stick like when we play the puzzle. The patient's priority was to cover the front side and the crown area, but during the live evaluation we also found some thinning and empty areas in the mid-scalp, especially at the parietal sides, as we call them, the sides of the hair. There was some thinning. Out of this number 4,200, 2,900 were used in the front side and the parietal sides, and 1,300 was used in the crown area. And here we can see the result of the patient. The front hairline, or the front frame of the face, or the frame of the face as we call it, is completely rebuilt. The hairline is natural because it's one of the key features that we always talk with the patient is the correct design of the hair loss, avoiding the pitfalls like the hairlines that doesn't match the face anatomy or facial ratios or the extent of the hair loss of the patient. So the hairline looks really natural with the good density in the front side, so the face is reframed. That's very important for us. You can see a good density in the front side, front forelock and the front third, and also reinforced parietal sides. And finally, the crown area. And the crown area, we were able to implant 1,300 grafts. The crown area reconstruction is always a challenging case. The important point is that to do the calculation of the open area and put an average number of the grafts per centimeter square. We always tell the patients that the good number starts off, like for the crown area, to create some shade of the hair, we need at least something around 30 grafts per centimeter square. So for example, if the open area is around 50 centimeter squares, you need at least 1,500. The more, the better. In this case, you can see the crown area also looks good. Yes, it's not a very high density, but it's a good density that covers most of the open spots at the top area. The front line looks nice and it's natural without some weird or unnatural looks. So the patient is happy, we are happy. That's one of the examples when the correct planning and good preoperative distribution of the grafts were made correctly, that gives a good outlook. And of course, for the patient, after the surgery, we advise him the medical treatment with finasteride and minoxidil to prevent further loss of his non-transplant hair as well. If you have any questions, you can always ask them below the video in the comments. Thanks for watching us and stay tuned.